Why do STIs become drug-resistant? Imagine a tiny battle happening inside your body every time you get treated for a sexually transmitted infection. Some germs are clever. They can change and adapt, making it harder for medicines to do their job. This is how drug resistance in sexually transmitted infections develops. It mainly happens because the microorganisms causing these infections, like bacteria and protozoa, can mutate and evolve over time. These mutations can alter the parts of the bacteria that antibiotics target, or they can produce enzymes that break down the medicine. Some bacteria develop ways to pump the drug out of their cells before it can work, making the treatment less effective. These genetic changes can be passed from one bacteria to another, spreading resistance across populations. Another big factor is how antibiotics are used. When antibiotics are prescribed incorrectly, taken in the wrong doses, or not finished completely, some germs survive. These survivors are often the ones with resistance traits. They multiply and become the dominant strain, making future infections harder to treat. This misuse and overuse of antibiotics are major drivers of resistance. It's like giving germs a chance to learn how to beat the medicines meant to kill them. Access to antibiotics also plays a role. In some places, antibiotics are available without a prescription, or people might buy low-quality or counterfeit drugs. These substandard medicines may not contain enough active ingredients to fully kill the germs, allowing resistant strains to develop. Poor regulation and oversight can make this problem worse. Infections outside the genital area can also contribute to resistance. For example, infections in the throat or rectum, especially among certain groups, can be harder to treat and may harbor resistant bacteria. These resistant strains can then spread more easily within communities. Different pathogens have their own tricks. The bacteria that cause gonorrhea, for example, can change their surface proteins, increase the number of efflux pumps to remove antibiotics, or decrease their cell permeability. This makes them resistant to many drugs, including some of the last options like cephalosporins. The protozoan causing trichomoniasis, called Trichomonas vaginalis, can also develop resistance to medications like metronidazole. This resistance involves changes in how the organism metabolizes drugs and manages oxygen, but scientists are still studying the exact mechanisms. Resistant strains can spread quickly, especially when treatment options are limited. Some bacteria become resistant to multiple drug classes, leading to multi-drug resistance, or even to all available drugs, which is called pan-drug resistance. This makes infections much harder to treat and control. In the world of sexual health, drug resistance is a serious challenge. It highlights the importance of using antibiotics carefully and only when prescribed by a healthcare professional. Always finish your full treatment course, even if symptoms go away early. Regularly monitoring resistance patterns helps guide effective treatment choices. Researchers are working hard to develop new medicines and vaccines to stay ahead of resistant strains. And practicing safe sex reduces the risk of infection and transmission. By following these steps, we can help preserve the effectiveness of current treatments and keep STIs manageable for everyone. Remember, always consult a healthcare provider for personalized advice and treatment options.